All right, so we're working with Max here today. He does rough carpentry, masonry, construction, correct? Got that right? We started care with him because he had some pretty bad low back pain. He's gotten great results. We're working on today. He's had a little bit of a flare-up. Come on over here. He's had a little bit of a flare-up, it sounds like. So we're going to go through our protocol here, figure out what's going on with his low back. He has some symptoms. It sounds like could potentially be some inflammation around his discs. When a person starts getting a disc that swells or inflames, we obviously want to stay on top of it. Make sure we get this under control so it doesn't get worse. All right, turn your head to the left, Max, then to the right. So we're going through head straight. We're going through our protocol here. This is how I find exactly what we need to adjust. Even though the symptoms are here, we're going to evaluate the entire spine. We want to find exactly what could be causing that problem in the low back. So we've got a subluxation up here at C2. Again, we're using our integrator to adjust. This is a really precise tool that we use to adjust. We use a neurological assessment so we know what we're doing with him. So we're not your typical twist and pop your back chiropractor. I would say we're more precise. I think these get better results as well, faster results, what we're looking for. All right, so correcting the subluxations up in the neck. Let's go through our protocol, see if there's any changes here. Head to the left. Head to the right. Okay, so we got the neck cleared out. So we're going to assess his low back now with a little leg lift. Lift here. Which feels heavier? Yeah, I would guess the left. So when his left leg went up, he contracted the left side of his low back muscles. It should be the opposite. So the leg should move. This leg or this muscle should contract. So we're going to work on some ribs. So he's got a tight hip flexor through this left side of his low back. We're going to adjust the ribs right along where his diaphragm is. This is going to relax. This is going to relax his hip flexor. Lift here. Is that lighter yet?
Yeah.
Okay, so it's getting lighter to lift because we're getting his hip flexor to relax. We never want to stretch these hip flexors. A lot of people stretch tight hip flexors and they make this problem a lot worse, which we don't want to do, obviously. Lift here. How's that feel? So now when he lifts his leg, we have the proper muscle firing going on. So we're getting the pressure off of this lower back where that disc is. So just tell me if you feel tenderness when I press here, yes or no. Okay, should just feel like pressure, but does it feel tender? Is there any tenderness there?
No.
How about here? Okay, how about here? Okay, good. Give me another deep breath in. Let it all go. So at this point, it looks like we caught this early enough. He's got the signs and symptoms of a disc that's beginning to swell. If we catch it early, take a day or two for that inflammation to come down. If it gets re-aggravated, swells up more, it's a very painful injury. It's nothing that we can't help or that we can't treat, but it can be very debilitating. The more it swells, the longer it takes for it to fully recover. All right. Okay, we're going to do some decompression now on Max's back. Decompression is something you can do at home for free. You don't need to hang yourself upside down. You definitely don't need to hire a doctor who's going to strap you to a bed that decompresses you and pulls you apart. Those decompression beds cost thousands of dollars. You don't need that. You can decompress at home for free. So I'm going to show you how we have Max decompress his low back. This is how we're going to get pressure off of the disc. So go ahead and get down in your position, Max. He's done this quite a bit, so he knows what he's doing. If you can see from this angle over here, you can see how he's got his knees at 90, his hips, and he's letting his low back sink here. Let's get you up a little closer so your chest is more on the table, Max. So you can just rest your upper body there. Why don't you come over to this side? Let's switch. All right. So you can see 90-degree angle here. We're going to use this table. You can use your couch or a chair, anything that's close to this height. He's resting his upper body. The low back is dipping down in that lordosis. This is how you take the pressure off your disc. I have my patients do this. They hold it for just 2 minutes. They'll do it once an hour when they're having a flare-up on their disc. Other than that, for general maintenance, I'd recommend Max do this at least once a day, twice a day would be good as well. So home decompression, this is what you can do. Don't spend thousands of dollars to decompress your low back. You can do it on your own.